Now, the Health and Family Welfare Department has addressed a presser on the myths about COVID-19, and Commissioner of the department, Pankaj Kumar Pandey, also spoke on a host number of issues. First and foremost, he asked the people not to panic. Take a listen.
And there is a lot of time. We had one positive case which is linked to Bangalore. It is basically found out in Telangana, Hyderabad. And there is a lot of panic amongst people. So I will first like to inform that you need not panic. The mantra should be that don't panic and be aware about the disease. The coronavirus or COVID-19 is a flu, or it is a viral disease, just like a common cold and other diseases which are viral diseases. The symptoms are basically similar to common cold, which is cough, sneezing, and fever, which can further result into pneumonic conditions.
The Commissioner also stated that the people need to take certain precautions and also asked them to avoid crowded places.
Now there are very simple rules and simple procedures which we need to follow. The most important is the cleanliness, which means the personal hygiene in terms of washing hand properly has to be followed. The second is the sneezing and the coughing etiquettes, which means you close your nose and mouth while sneezing, coughing and all that. See, the virus transfers only through sneezing, coughing, and when a person is in close proximity to the individual who's affected with the virus, or where it is a positive case. So only in those cases it can be transferred at a distance of 3 to 6 feet. So the basic is, if we are able to maintain these etiquettes of covering our mouth and nose while sneezing or coughing, it will avoid the transmission. The second is obviously the cleanliness is extremely important. The other thing is, you need not panic about this thing. There have been buying of masks and all that, which is, I'll say that it is an overdoing of the things, because right now there is not a single positive case which is there in Karnataka. The positive case which has come was here in Bangalore only for a single day. Now he is in Hyderabad.
Meanwhile, the Commissioner also cleared myths on quarantine and also explained about the types of isolation. Take a listen.
Now the people who have come in contact, so the basic protocol which we follow in case a person is positive is that we isolate and keep the person in the hospital. And also in case we have a person who is, and like this particular person who had positive, what we have done is that we have traced all his primary contacts. So the people who are in regular touch with the person, those are his primary contacts. So primary contacts have been traced, and we have got in touch with all the primary contacts, and we have told them to go for home isolation, which means that you stay at home and basically work from home in case you have come in touch with a corona positive case on him. In case a person who is under home isolation, who has come in touch with a corona positive case or who has a travel history to the various countries which are affected by corona, and in case such a person develops symptoms like symptoms of cold, cough, fever and all that, my request is to such persons to get in touch with 104 helpline.
The state government has also assured that there was absolutely no need to worry, and in worst case scenarios, they were prepared to handle the situation.
We are all geared up. We have a lot of isolation wards ready. So we have got isolation wards in government and private hospitals. We have taken the assistance of the private hospitals also, and they have the isolation wards ready, which are in preparedness in case we need to isolate people in our hospitals, so that the hospital isolation happens and they can be treated there. The fatality rate is very low, so you need not worry on this. We also have ambulances ready. There are special ambulances which have been made ready, which are disinfected and all that, and they are made ready in case we need to transport people who are symptomatic or who are feared to have any infection.
The Commissioner of Health and Family Welfare Department also gave a travel advisory and the rules to be followed once they landed at the airport. Take a listen.
At the airports, we are doing the screening of all the patients, all those who are frequent travelers. I request you to avoid traveling to these countries which are affected by corona, especially the 11 countries which are high on the radar: China, Japan, Korea, then Italy and all these countries. Apart from this, if you are traveling and you are coming back, then at various airports of the country, we have got the self-declaration forms. I request you to fill up the self-declaration forms, and there are thermal scanners at the airport where we basically find out if a person has fever and all that. So we primarily depend on your self-declaration. So I request all of you to declare if you have cold, cough and all that. That is good for you and for the others who are around you. Then similarly from the seaports, also from Karwar, and we have got seaport at Mangalore. We are screening the people coming from these seaports also.